Reverse transcription polymerase chain reaction, or RT-PCR, has been the gold standard for detecting whether a patient is, at the time of testing, infected with SARS-CoV-2, better known as COVID-19. The long, tedious process takes a few hours to complete and requires highly specialized chemicals, particularly a reagent, in order to be performed successfully. Through the tribulations of the pandemic in Malaysia, the RT-PCR testing locally began with an achievement. We successfully developed our own reagent. We spoke to Dr T Ravindran, the head of the virology unit at the Institute of Medical Research Malaysia, on how this happened and how it led to the detection of Malaysia's first COVID-19 cases.
In order to detect, you have to design according to the virus. To do that, you have to use a software and you develop the primers and probe. But you must have the sequences downloaded into a website called GSite. GSite is actually where the information of the virus. So for H1N1, because it's influenza, so we have designed according to influenza target. The primers and probe will only detect influenza. Having said that, for COVID also, you must have the information of the genetic sequences for you to develop. So thank goodness, Chinese scientists, I think they have done the full sequencing and they upload into the GSite on the 11th of January. And we, because IMR is also the WHO National Influenza Center, NIC, which is, having said that, we have access to the GSite website. And my officer will have access. I also can get access. We look into this, and then we saw the Wuhan coronavirus. I thought, goodness, they have already published. Then quickly on the same day, we have the capacity. The same day, we developed the primers probe, and we ordered. Basically, we ordered to a company, and the company sent the reagents on the 21st. They sent the reagent, and the 21st we also got the positive control from University of Malaya, and we optimized the test within the same day, because we have the experience. Same day we have optimized the method using the positive control from University of Malaya, and that's when we are good to go. From there we are good to go, and of course after that we do get samples from those who have PUI from coming back from China and all. We did not get anything positive until 25th.
The first positive cases were Chinese tourists who entered Malaysia from Singapore via Johor. They were stopped and detained for testing during their entry.
Under the international health regulation, it is actually a commitment by countries to inform the other country of potential danger in terms of infectious disease. So when Singapore detected their case, they reported also to Malaysia. And because of that, we also take the samples that we got from the tourists who came to Johor. We tested that, and actually what happened is that it was positive. We detected. So basically, it was first it was detected by using the reagents that IMA developed, was detected by MKAK Sungai Buloh, and then we confirmed on the morning of 25th of January. And at the same time, there was one of the group and the tourists who came in, one of them were admitted in hospital, and that sample also came to IMR, and also we detected that case. So what happened is that when you have that, there were a lot of things happen to us, like emotionally as well as the stuff. At first, we were excited because we finally detected the case. But then, having said that, we also something worrying because now we know as SARS-CoV-2 has already entered, has already come to our shore. So, so there's a kind of preparedness. We have to know what else can be, so that we are prepared.
Dr. Ravindran and his team were standing by at the laboratory from 6 a.m. on the 25th of January 2020 to receive the samples from the tourists who arrived in Johor. This was a critical moment for them, as they knew they could very well be looking at the nation's first ingress of COVID-19.
It's actually on a Saturday, or 25th is a Saturday, but because urgent, so we all were working, and then by noon we confirmed already because we got in the morning, early morning, we got the samples even just before noon actually, because that's like urgent. So we sit into everyone put their best effort and quickly did, and then we were working around the clock just to confirm, because it's something exciting lah. I mean, because we know, oh goodness, is it going to be first positive, and then okay lah, we have to accept the fact that it is the first case of COVID, but it's not something unusual lah. Eventually, we all think, basically looking at our experience with other infectious like H1N1, eventually in infectious disease, when people go take the flight, they will have some spread. So these things that we have to accept the fact lah. But very important, like what I mentioned, you detect and you contain. It's very important. At that point, of course, because the director of IMR, I must inform the director of IMR. I call her. I have to sort of disturb in the morning, and then at first she was as well shocked, but asked me whether is it you have confirmed, ensure it's correct. So yes, it is. Then after that, but she was happy because that we have the capacity. Basically, many labs at the point of time, looking at the world, many labs did not have the capacity, and IMR in Malaysia is one of the labs that has developed our own reagent, and she was very proud of us. So to have the capacity, so we are happy, but happy in the sense that we have the capacity, but said that we have the virus has already come to Malaysia. So, and then after that, the hierarchy of reporting, the director will report to the high-ranking officer in KKM, and this like that.
Less than 2 months later, on the 11th of March 2020, the World Health Organization declared COVID-19 a pandemic. Shortly afterwards, Malaysia entered its first movement control order. While there is no shortage of criticism when it comes to Malaysia's response to the pandemic, our preparedness to deal with this onslaught is largely thanks to Dr. Ravindran and his team at IMR, who worked without hesitation to develop the reagent and testing procedure for COVID-19 in Malaysia as soon as they had the necessary knowledge. As we continue to weather this storm, we owe it to our brave frontliners who put their lives at risk in the battle against the coronavirus.